Yes, thank you. Um, so we could take one more if you want to address the last one that popped up. If not, we'll follow up one-on-one. Um,
I think there's something about soy. You want to do a soy? I'm looking at there's the Q&A. There's also a webinar chat.
um,
And
yes, I was looking at the last one in the Q&A.
the cannabis
Yeah.
one. Yeah. I can do both super fast.
Okay. I
So
mean,
cannabis, actually ASCO, the American Society of Clinical Oncology, just put out a guideline about cannabis use. And so that's a great thing for patients to reference because I think they actually have a patient like little summary that you can look at. Um, but I think it can be helpful in certain situations, especially for managing things like fatigue in certain cases, sleep, joint pain. But I would check out that guideline because they really go through what the evidence is and what we can do. Now, and in terms of like products and all of that. In terms of the question was if I end up consuming soy by mistake via oil. So soy is minimally processed soy is actually good for us. It has a protective effect. So this is your tofu and edamame and miso. What we want to stay away from is that heavily processed soy, like the soy protein isolates and things like that. But it's not this again all or nothing. If you have a little bit of processed soy, that's okay. We just want to avoid that kind of on a frequent basis.
is soy milk considered processed?
So it's kind of in that minimally to moderately processed category, but you want to look at what's in that soy milk. I always like to look at the ingredients, right? Because there are some soy milks that have like a ton of stuff added to it, which would move it up in that processed category. Where we're thinking processed is like you look at the frozen food and it says plant-based and it's like soy nuggets, right? And you look and it's just really heavily, there's something good in there. I like the tofu, soybeans, miso, and edamame, things like that.
You know, one thing that surprised me is looking, as I've tried to take better care of myself after diagnosis and make better healthy eating choices. The milks, the milk alternatives, the ones that have the lesser ingredients, which are the ones that are better for you, tend to be the ones that are not in the refrigerated section. And have you noticed that? And then like the soy milks that are in the refrigerated section tend to be the ones that have 15 ingredients.
Yeah, and I think, that's a big dairy, such a controversy, right? Do we need the dairy alternatives? Can we have dairy? And the verdict's really out on this one in terms of breast cancer and dairy. I think everything in moderation. I think some of the dairy alternative milks have a lot of added sugar. And so we're always looking at that as well. And I mean, ultimately, I'll tell you, look, it's just impossible to eat a completely clean, no processed food diet. And so I think aiming for that is probably unrealistic, but thinking about what am I doing 75, 80, 85% of the time, you know? And how do I feel after I put these foods in my body? Do I feel good? Do I feel like they're fueling me? And then once in a while, it's okay. It's okay to have that cake or that donut. That's fine. That is not going to cause your cancer to come back. It's just not.
Okay, perfect. I would love to, this may be kind of putting you on the spot, but to end this part of our conversation, is there anyone on social media, like a registered dietitian or an oncology nutritionist, that you feel is a good person to follow for this kind of advice?
So I'll actually plug the dietitian at our cancer center in some ways
Okay.
that we hired her because we love her and love the work that she's doing. So Jessica Cording is her name. She's a registered dietitian. She um, does actually on our hospital website, Valley Breast Center does cooking demos for our breast cancer population once a month, and has all her recipes there. And she's really focused on moderation and plant-based eating. So she's definitely a go-to person. There's a lot of people. There is another, I will give you her name right now because I love her also. And she's actually a breast cancer survivor, Allison Tierney. She's wholesome.cancer.nutrition. She's awesome and she does so much great work on there as well.
Okay. I
That's
mean,
not inclusive. There's so many other wonderful
yes.
people, but these are just the two that come to mind.
Yes, yes, we appreciate that, and we'll write those up in the transcript and kind of the blog post summary of this event.